Here's the question, is your environment good for you? The CDC says many Americans lack environments that create healthy eating habits and weight loss. Cone Health implemented a program that helps people struggling with obesity come up with a plan to build a healthy lifestyle. WFMY News 2 Sydney Moore spoke with a woman that benefits from that program.
Self-confidence and self-care are two skills Greensboro native Katrina Hamilton says are important if you're trying to live a happy life.
Sometimes we look for those validations through outside forces, and outside forces are not going to always give us what we need.
One way she takes care of herself is through exercise.
Tuesday and Wednesday mornings, I do spin cycling class. Thursdays and Saturdays, I have swim practice.
A warning from her primary provider in 2020 is what got her into that routine after she was diagnosed with pre-diabetes.
I told him this would be the first and last time we would have this conversation.
Her provider told her about Cone Health's Healthy Weight and Wellness program. She immediately signed up.
You fill out probably a 20-page survey, your eating habits, your dietary, your physical ability, and everything of that nature.
Healthy Weight and Wellness is a medical bariatric clinic helping patients transform their lives and in the journey to do so, lose a little bit of weight. But we manage all chronic medical conditions associated with the disease of obesity.
Dr. Alexandria Ukleja with Cone Health works with patients who are part of the program. She says it challenges people's preconceived ideas when it comes to weight and food.
Giving people kind of tools to start changing that relationship and then implement some activities in the form of exercise to not just help them lose weight, but be able to keep it off with that new relationship with food.
After 4 years of participating in the program, Hamilton has seen great progress.
There is a picture that I have. When I look at myself now, I don't look like that. I can look at that picture periodically and say I don't ever want to look like that again.
She also says she's full of energy and is in awe of the hard work she's put in over the years.
As a woman, we don't always do what we need to do. We don't always do self-care. We always take care of everybody else and not ourselves. So healthy weight and wellness means self-care.
While working out consistently can be tough for some.
Don't let a diagnosis be your motivation.
Saying yes to that friend who invites you to take a walk or joining a group class.
Get started now.
Are the small steps that can lead to a better self-care routine. In Guilford County, Sydney Moore, WFMY News 2.
All right, we've heard one story, but let's talk more about what those lifestyle changes can include, how to stick to them, and options available. Dr. Alexandria Ukleja with Cone Health, Healthy Weight and Wellness is with us. She says, call her Dr. U. She says that's what her patients call her. All right. So, many times we're focused on the number on the scale or the amount of weight that we want to lose. But what are the health benefits, just the health benefits of maintaining a healthy weight?
So there are lots of healthy benefits to just changing your weight or even maintaining a healthy weight, and that's keeping pretty much all chronic medical diseases you may have really in check. There's attributable improvements in all biometrics with 5 to 10% weight loss. It's really the maintenance that we're after to keep that where it's controlled, and that tends to be the most difficult part for most patients.
Yeah, for sure. I mean, to consistently do that. All right, so let's talk about this. I'm sure there's a lot of people who are watching right now who are ready to get started losing weight. What are the first steps that they should take when they get started?
So I love this question. I think that there's lots of things people can do to get started. First is just start becoming more aware of the habits that you have. Some of the reasons that you eat or the habits that set you up to eat. Maybe restaurants you all go to or the schedule that your family adheres to. What foods do you like? What foods do you not like? And that is very helpful for when you come to a clinic like ours to help us set you up with an eating plan that's really personalized. You've already thought through some of maybe the pitfalls that maybe you've identified, or maybe even some of the foods you like and don't like, or reasons that you may have come up with why you're in the predicament that you're in.
Okay, like for instance, like if schedule makes it so that you're always on the run on Mondays and Wednesdays and you always go through the fast food line, saying that can help you help them make a better plan.
Right, because there's no such thing as bad food. It's just a matter of what's the most nutritious option in the options that you have available. And that's where clinics like ours come in, or doctors like me come in, where we can educate people on how to make more nutritious choices and what's readily available.
All right, because that's my next thing, like healthy eating. You know, people always want to follow this diet or that diet. What should a healthy, balanced diet include?
So a healthy diet is really personalized to what you like. So it's hard to find or make a general one size fits all answer to this. I would say a healthy, balanced diet incorporates, whole grains, protein sources, and protein sources are vast. So it's really dependent on what you like, vegetables, and a little bit of indulgence, because you can't cut out those things forever and expect to not then have a relapse into that unhealthy eating pattern.
Okay, all right. So how vital is regular physical activity for sustainable weight loss, and what should that look like? Because a lot of people say it's only what you eat, it's not what you're doing activity-wise.
So activity is super important, especially when it comes to weight loss maintenance. Activity is the only way to get active muscle engagement, and muscle engagement or muscle mass retention is the only way to maintain a metabolism, which is really then the only way to maintain weight loss. Weight loss by itself is a lot of nutrition, okay? It comes down to what you eat. But when you transition to that maintenance phase, it's exercise. And that foundation of exercise needs to be implemented before you get to that phase in order to be able to achieve the amount of activity that would be required to be able to stay in maintenance phase.
Okay, and is there a certain amount of activity that has to be done?
So there's a lot of data out there about what the lowest amount of activity is. And what I generally tell patients is we should be aiming for 150 to 300 minutes of moderate to vigorous activity per week. And moderate to vigorous is very specific to each individual, because what's vigorous for me may be very easy for someone else, and vice versa.
Okay, so let's talk about how we deal with stress and what stress has to do with all this.
So stress plays a huge role in all of our daily lives. And unfortunately, stress then elicits us to release stress hormones, one of those being cortisol, which physiologically then impacts both our blood sugar usage and regulation. And that then drives most people to do some sort of stress eating or have a higher carb drive, which then elicits us to intake more carbohydrate, which plays a role into that insulin resistance or prediabetes most patients struggle with.
Okay, you know, everybody wants to see quick results. I mean, that's not a new thing, right? We all want to see quick results. So how quickly can someone expect to see progress on their weight loss journey through those lifestyle changes? Let's talk about realistic expectations.
Our expectations here, Tanya, are really 1 to 2 pounds per week at most. And it really is based on the engagement of the patient and how compliant they are with the changes we're trying to elicit. And what I have to remind people is, if you're running a marathon, you don't remember every single step. And so to not get bogged down, if one day perhaps you're not as compliant, you're making these changes so that in the long haul, this is how you live your life and you don't have to think about it as much.
Okay, all right. So what about like ways to keep us motivated? Because when we don't have that quick, result, sometimes we kind of get down and we're like, all right, I'm just going to throw in the towel.
And so there's lots of ways to keep patients motivated. What I will tell you is, oftentimes we're so geared to focus on the things that we didn't do right. I know I did this, I did X, Y, or Z. Instead of realizing that there's so many changes you actually have made if you were in this situation, let's say 6 months prior before you started on this journey. And it's acknowledging those changes, which helps elicit that positive reinforcement of, oh yeah, I have done this. I have made changes and I didn't even have to think about it. That really sets patients up to be continuously engaged and motivated.
Oh yeah, because it's so much easier to be like, oh, I was so bad this weekend, instead of, I have come such a long way, I can continue to do that. I get it.
Correct.
All right. So a lot of people have lost weight quickly with weight loss medications. When should someone consider a weight loss medication?
So that's a kind of tricky question, just because every patient is different, and some patients need weight loss medications. They are championing changing how they eat, and unfortunately they just stay stuck. And that's where medication really comes in handy. Some patients have a lot to lose, and so making those changes gets that ball rolling while we try to figure out the insurance, the kind of behind the scenes insurance approvals. I would say if you're someone who feels like you've tried everything and you're still stuck, that is where weight loss medication really plays such a great role, because it gives you the ability that you didn't have before to see that scale change.
Okay, all right. And of course, Cone Health has resources available to help people on their healthy weight and wellness journey. We appreciate your time and your expertise. If you missed any of this, you want to share it maybe with a family or a friend, we're going to have it in the To Your Wellbeing section online.